Hi, I'm Caitlin Rollins, the director of the Cardiac Neurodevelopmental Program at Boston Children's Hospital and a recipient of the Children's Heart Foundation Research Award. The Children's Heart Foundation provided funding for our project, which is examining how fetal brain MRI can predict brain structure and neurodevelopmental outcome at school age. Children with congenital heart disease are at high risk for early developmental delays, as well as difficulties later in childhood. For example, difficulties with attention, executive functions such as planning and organization, and visual spatial skills are fairly common. There's a wide range of neurodevelopmental outcomes in children with congenital heart disease. Some children can participate fully in a general education classroom with minimal or no support services, while others may require more intensive services to help them. An important focus of our work is identifying the children at highest risk of more significant challenges and developing strategies to mitigate this risk. Since 2014, over 150 women have enrolled in our research study, undergoing fetal brain MRI twice during pregnancy, along with an assessment of their baby's development when they turn 2 years old. From our earlier studies of this cohort, we learned that the size of the baby's brain in utero predicted their development at age 2 years. Because children's brain structure and development change enormously over the first several years of life, it's important to study long-term outcomes at school age. It's also important to understand how fetal brain MRI fits in among other factors, such as the type of heart disease a child has, medical or surgical complications that the child might experience, or genetic factors in predicting development. With the Children's Heart Foundation funding, we have been able to bring families back at age 7 years to obtain brain MRI, neuropsychological testing, and genetic evaluations. Understanding how the baby's brain development in pregnancy predicts these long-term outcomes will help us develop strategies to identify and treat the highest risk babies as early as possible. We are enormously grateful to the Children's Heart Foundation, to its volunteers and donors, and to the patients who have participated in this research, and we look forward to sharing the results with you in the years to come.